A county coroner, I always explain, we're not medical examiners, we're not forensic pathologists, and we're not crime scene investigators. We're death investigators. They know something. Is the suspect in custody, or is he one of the deceased?
Unknown.
Am I clear to go all the way in, or do we got a guy running around with a gun?
Everything's clear. Everything's...
Well, you can see by this road why we use a pickup truck and not a minivan. Hold on to your giblets. I'm doing all right. I don't have any major complaints currently. The budget in our county is tight. You're forced to be thrifty, scrounge up things. That kind of mentality went towards when I started building the morgue. For being a coroner, it's essential. That was all done on close to a zero budget. We still have grand ideas and want to provide professional service. You aren't here in Okanogan County because the pay is great. In fact, it's close to the bottom, but this is my county. U41 Okanogan.
U41.
We clear the scene and route to the county facility.
41-215.
Well, that's the danger of estimating when we think we'll get out of here, because you're always way off. But it's all right. It might be odd to you that the guy who deals with death is part of public health. It is important to public health to let people know what our citizens are dying of. Father, Son, Holy Spirit, bless the Lord. Our Father, who art in heaven, hallowed be thy name. The kingdom come, thy will be done. Well, we just tucked in our people at the morgue. It's 5:30. Now, one of the most difficult parts of the job is driving home after the sun has risen and you have not been to bed. So that's our task for the next 45 minutes. Best thing they ever did was put in these center line rumble strips. The number of cases that the coroner's office here in our county has gone up dramatically in the past 2 years. The logical thing is to ask why that is. 2 years ago, the entire world experienced the global pandemic. It, as you can imagine, impacted the coroner's office. If the local hospitals are full, all with COVID cases, people with other medical conditions, they're putting off treatment and trying to deal with it at home.
16 Okanogan, disregard, I can see his vehicle.
1636.
You can see me. That has resulted in more at-home deaths from things that have nothing to do with COVID. 41 Okanogan, I'll be out. Say you had a heart condition and you're being urged by your family to go see a doctor. Remember, in all the past 2 years, trying to get an appointment to see a doctor was a big challenge. I can't make any direct correlation to COVID. we had a lot more suicide deaths, and we had a lot more overdose deaths.
Well, I think I timed that just right as far as how much pain I got left.
Suicides are a really hard call to go to. And this is gonna take a while. An event, and a suicide event is so horrific that your professionalism is needed. All right, I'm going to get it together. It's the downside of being a rural coroner, where you know, I don't know everybody, but you're gonna know people and feel their grief. But I have to be in control of myself and my emotions so I can do the job as a coroner. Probably a good thing I'm retiring, huh? One of the few things in the world man can't change. And I can't do anything for the deceased. They have died. But I can do something for friends and family.
They'll wash her in rose water, they'll burn sage, they'll sing.
So I can do something for the decedent and taking care of their body with respect.
I have a bandage in the truck.
Yeah, like a bandage.
That's what I usually put on there.
Yeah, that's a good idea.
A lot of tragedy in the tribe here in the last few days.
It was 3 yesterday I heard of. So.
Yeah, and that's why my office was involved with this case. Drug overdose is what we're suspecting, but mostly what they're going to be documenting is that there is no visible sign of death. So it comes down to toxicology. Yeah.
We just want to send her on her way as soon as we can.
Yeah, no, I understand that.
I understand the process too that you guys are trying to do, and I'm all for it. My brothers
Okay.
are all for it.
Okay,
They
that's
want
good to know. You'll see on her, just below her collarbone, there's a Band-Aid, and that's just where we drew the blood sample.
Okay,
But other than that, she's cleaned up and presentable. So you ready for this?
I'm ready.
Okay, thanks for being here.
You have to put your shoes on, take them steps, move on. She told you she loved you. She meant it.
Most of my adult life has been serving this county, from emergency medical to law enforcement to now the coroner. I feel like I established a coroner's office out of thin air. I'm proud of that. I have something that I can hand off to another person, but it's an office of one, me. You're always on call. Not everyone can do that, and not because I have any great skills. My gas budget for the year is almost already shot. It's because of the other responsibilities you have in your life.
No option. Can't work from home on this job. 41 Okanogan will be out.
The person coming in after me is gonna need to do it differently. The caseload has drastically increased. I don't think it's sustainable.
All right, we're rolling.